Namaskar, Sat Sri Akal,
जय हिंद
and
मैडम।
a very good evening to you, sir.
थैंक यू मैम।
And so today we start with our 297th episode of Gyan Pravah. This Gyan Pravah is a brainchild of Dr. Sunita Tandulwadkar, our Fogsi president. She is very keen to, you know, give proper space and proper time to her chairpersons so that they can contribute to the knowledge, and every day one of us do this podcast from 8 to 9. So 8 to 9 you have to be with Foxy for the podcast. So today our guest is Dr. Brigadier Sharma sir, and madam also most of the times always she joins with us to welcome our guest, but today as she is in a conference in the city of Gurgaon and she is delivering a lecture at the inauguration, that is why she is not able to join with us. So, I will just introduce Madam in few words only because she doesn't like that I keep on going and delivering about her works because her work is tremendous. And incidentally, Sir and Madam both are from the same city of Pune, and both are legends in their work and reproductive medicine. Madam is a visionary leader and one of the most respected names in reproductive medicine, and she stands at the forefront of advancing women's health in India with unmatched dedication and pioneering contributions. She has shaped the future of infertility care, and she currently heads the department at Ruby Hall Clinic Pune, and she is the chief of IVF and endoscopy, and she also heads the Solo Clinic, a center for excellence in infertility, and she has established the Cell Center by the name of Alive, and which is working towards the research as well as the treatment part with the stem cells. And the new branch of that has also been now open at Mumbai also. So I lovingly call Madam as Sachin Tendulkar of our Foxy, and her nature is very inclusive. She keeps us all with her and always gives us due credit for whatever we do. So now I welcome Brigadier Sharma sir. He is from the discipline of the army and he has dedicated his life to the army and also to the infertile couples. And Sir is a pioneer of IVF in India and one of the most respected names in reproductive medicine. Currently, he serves as director and of the Ma Institute of IVF. Previously, he was at Primus Super Speciality Hospital, and before that, for years together, he has been working in army, and currently he is the brigadier status. And he is a graduate from the prestigious Institute of Armed Forces Medical College, Pune. He was the founder director of the ART Center at Army Hospital and RR Hospital in Delhi. And then he was shifted to Pune, where he started the Government IVF Center, which is the very leading institute now. And he was also the general secretary of the Indian Fertility Society and advisor to the numerous ART programs in the government medical college and private centers across India. He is such sought after speaker at national and international IVF conferences where his accustomed ART protocols are widely acknowledged and adopted. And he has been my teacher also. I have learned a lot from you, sir. So most welcome. And you, sir, has he has achieved many accolades and medals in his life. Vishisht Seva Medal by the President of India and prestigious uh, Jagdeshwari Mishra Award of Foxy and several other awards from Foxy, ISAR, IFS, and from armed forces. With deep compassion and hope, he is always there to help the people. So, welcome you, sir.
Thank you,
Sir,
ma'am.
first, welcome, sir. Just, sir, just first thing I would like to know from you is that what was the reason for you to join the army? And my this video is lacking, so I'll just switch off my video and we'll be back in a minute. Yes, sir.
See,
Yes, sir.
there's a very nice saying, पहले बनती हैं तकदीरें, फिर
Hmm.
बनते हैं शरीर, इसका भी कोई
Um,
कारण होगा. So there is always a reason for everything which is happening in this world. So my journey started, way back when I was in school. I did my schooling from Kendriya Vidyalaya, where I was exposed to the uh, army students from the army background, and also I would see, the army officers coming to the school and the or the dress and everything, which they had. So I thought that time, uh, that was I think fourth or fifth class, that if I ever grow up, I will go up into the army only and I will join army. That was the first step. The second thing was 1971 war. So where my father was actually in railways and our house was near to the shunting station of the railways, where the ambulance trains used to bring the soldiers who were wounded from the war front. So there was an overhead bridge. So and I was in seventh class that time. So I, along with my elder brother, would stand on the overhead bridge and see how effectively they were carrying out their work, taking out the patients from the ambulance train, the uniformed, staff over there, doctors, nurses. It was, out of the world sort of experience. How effectively they were working and removing the patients from the train and putting them into the ambulance and sending to the military hospitals there. So that second thing came to my mind is that if I have to join the army, I would join as a doctor only, because I saw the doctors, doing a human service to the wounded soldiers.
so no one from your family is in
No,
army.
no, I'm the only one from my family.
Okay.
And then afterwards, when I was in 11th class, that time we did not have any sort of information like Google's and all. We didn't know which medical college to join and all.
Um,
So one of my senior, he had joined from FMC and he had
okay.
come on leave. So then
Hmm.
I got hold of him and I wanted to get information, what type of college it is and what is this thing. So he told me one thing: once you join FMC, firstly it is almost costing nothing, and
Uh,
as a student, and secondly you will pass out in 4.5 years. There is no strikes over there, because in those days, there used to be strikes, so every batch
I
will
know.
get
I have
delayed.
also faced those strikes, sir.
Yeah. So he
And
said,
my batch was delayed by 6 months.
yeah, so that is what he told me. He said, there are no strikes over there. You will pass out in 4.5 years. And the best is that service is assured after that. So all my aims, were fitting into that. And you can't believe it. I just appeared for the AFMC exam. I did not appear for any other exam because my aim was very clear that I would join AFMC.
यही करना है.
Yeah. Now the thing is, when I went for my this thing interview, because FMC selection, there's a written exam and then there is a
Hmm.
interview, then there's a medical. So I cleared the written exam and then there was an interview. And interview, every candidate is given a slotted time, 10 minutes. And
Okay.
I had almost more than 100 certificates with me to carry
अच्छा.
along with me in various fields, whether it's for declamations, paintings, class first, second, third, fourth, first, second class, all. The brigadier over there, he was just reading out each certificate. And by the time the 100 certificate came, he says, oh, 10 minutes is over. So, what, because the bell rang in time. So he just asked me one question. Um, the how many brothers sisters you are? I
Okay.
said we are seven brothers sisters. So he had a shock of his life. Because in
Uh,
army also that time there was short families, but in civil, we used to have big families. So he says, "How will your father manage your education?" I said, sir, I got scholarship throughout my school days, and I will work hard to get in FMC. Is it your mission? I said yes. He says, okay. Normally we don't tell you, but I want to take you. So that is how I got into FMC, and this is the story.
So then how did the journey to IVF came in your mind? Because you have many doctors must be, there before you, but nobody ventured out in this.
Yeah, again, the destiny always plays a role. See, immediately after my internship, I was posted in a field area, which is a semi-field area, where the soldiers, they're allowed to keep the families only for 6 months, because so that everybody gets a chance to keep the family. Somebody is sick, to get the take treatment and leave the family back home to the village. So one day, I was, I think, around 25 years old that time. So I got a call that some lady has committed suicide. So I have to go and sign the death certificate.
Okay.
So without seeing the dead body, I can't sign. So I said, "Where's the
Ah,
dead body?" He says, "That is in the house." So I went to the house to see the lady. It was a charred body of a young 25, 26-year-old girl on the floor, which was lying down. And during this charring process, there is a flexion of all the joints which takes place. So it was a horrible, because we had seen dead bodies as a MBBS students
mm,
during internship, but I had never seen such a charred, suicidal case of that time. So anyway, she was obviously dead. I signed the death certificate, and but I could not, because we were staying in the tents that time. So it was a semi-field area. So I could not sleep the 2 nights, because that woman's body would keep on haunting me. I would keep on thinking, this poor girl's father, what he will feel when the dead body reaches there. What about her mother, about sister, brother, and how the husband must be feeling about the whole thing. So I investigated that why she has committed suicide. So then I came to know that she did not have a child, and she was given ultimatum by the in-laws that now
mm,
you go for 6 months, stay with the husband, and come back pregnant. Otherwise, don't come back.
okay.
Now, now this the soldiers are only from the villages most of the time, so she could not go back to her father house, because she had other sisters also. She knew that if she goes back to the home, the other
हाँ तो
sister marriages
उनकी
will
शादी
be
नहीं
rejected.
होगी हाँ.
So she thought it's better to die in the lap of her husband rather than to, live a sad life in the village. So she committed suicide. So that is the time. In fact, actually, I wanted to become a heart transplant surgeon, because
अच्छा.
that time the army was basically the men-oriented army. There were
हम्म.
hardly any females except for doctors and nurses. There were no females there. So the new advancements at that time was IVF and heart transplant. Around 1978, the heart transplant also came at the same time. So my interest was to become a cardiac surgeon and do the heart transplant. But this particular incident, shook
Changed
my
everything.
this
Yeah,
thing. I said, no, I must do something for these ladies, because this is a bigger call, because it affects the family.
definitely.
So that is how I switched over my, the focus to the infertility. And I was in the field area, staying along with the soldiers in the tents. So I had a lot of opportunity to talk with them, their problems, because we were all brought up in cities. We didn't know the problems of the soldiers, how it is in the village and all.
हाँ,
So with
फ्रंट पे
that,
क्या होता है.
yeah, so with that thing in mind, I got a lot of information. I understood, this is the biggest problem for a soldier, because he is in the field area, the wife is in the village, and she's suffering whole day and night. So at that time, there was hardly any facility for
But
doing
was
treatment.
it difficult to start all this in army
Yeah, that's what I'm
hospital?
coming to. Yeah,
हाँ.
because now once my aim was clear that
हम्म,
I have to do something for this infertile couples, then I thought
हम्म,
what is possible now under the circumstances in the semi-field area. So
हम्म.
I used to read about the homeopathy. I used to read allopathy. I read everything about related to the reproduction, like Vatsayan, Kam Sutra. Everything I read it, so that I should be prepared for it. And many patients did conceive with these basic treatments which I could give them. And afterwards, you know, army has got a system. after 5 years of as a gynecologist, and when I took gynecology to get into infertility,
Getting to
and
infertility.
the family was against it. And in the Punjabi they said, "Teri mat mari hai, koi janani nahi aani tere
हाँ
ghar."
हाँ
Because we are the first year.
किसी ने नहीं आना तेनू दिखान.
Tere ghar, so what will you do? But I said, no, I'm not treating jananis, I'm treating the infertile couples. So I will
हम्म,
be doing gynae. So I did gynae, and
हम्म,
after 5 years, we have a program for super specialization. And luckily, I got selected for ART.
okay.
This is the first candidate to be selected for ART at that time, and the credit goes to my visionary mentor, General Punita Arora Madam, because till that time in army
अच्छा.
was just like a midwifery. So you
हाँ
just
बस
deliver
ऑब्जी
cesarean,
करो बस है ना.
like that's
हाँ,
all. No laparoscopy, nothing was there. But she is the one who brought endoscopy.
बट
She
आई
brought,
रिमेम्बर पुनीता मैम वाज इन आरआर हॉस्पिटल ना.
yes, yes, yeah.
हाँ हाँ हाँ
She was the
मुझे ध्यान है.
yeah, guiding
आई
force.
हैड हर्ड हर
Yeah,
लेक्चर्स आल्सो.
yeah. So she was there to guide me to, so I got my study leave, and then getting a study leave was easier, but getting a teacher was a difficult thing because there are hardly five centers in India that time. I approached all the centers and they refused, or one of them said, ki, okay, you pay, the amount of money which was my monthly pay every week. That time. So I said, I can't afford. But luckily, I met Dr. Sandan Sai madam, and she was very
हाँ
kind enough, without any charges and all.
मैडम तो एग्जाम्पलरी हैं सर, जैसे आप हुआ वैसे ही हुआ.
She allowed me to work there and learn from there for 1 year. My study leave, I was did it in from Bombay Hospital and a private clinic. Uh, so there I picked up the whole subject,
हम्म,
and then luckily got posted to the armed forces. No equipment, nothing. So what to
अच्छा.
do? So, but then
हाँ,
I did not give up. I said, let me try on the mice, because being a medical college, we had a animal house also.
ओके.
So I was lucky to have an animal house there. So officially they won't have allowed me. So I,
हाँ,
made friends with the in charge of the animal house, and
हाँ,
he would help me, stimulate the mice, and then we would, create this do dissection and take out the eggs. Because as a gynecologist, we had never worked under the microscope.
हाँ,
What is 100 micron? We didn't know what is 100 micron and how it will look under the microscope under different magnification. So initially, even the mice ovaries are surrounded by a fat. So the fat globules also look round. So I wonder whether it is egg or a fat globule. So it took time for me to understand this is a fat globule and this is a oocyte. And I did the first research on the mice, and that was the Jagdishri Mishra Award, which I got it for that by the Foxy.
अच्छा अच्छा. तो आपकी जो मैं देखती हूँ ना कि आपकी स्टडी ना बहुत मतलब बहुत ही डेप्थ तक है, मतलब वेन एवर आई मतलब वी आई थिंक वी हैव इंटरेक्टेड लॉट्स ऑफ टाइम्स, और आप कई बार लेक्चर लेते हो हम लोगों के, सब बात करते हैं हम लोग. तो व्हाट आई फील इज के योर नॉलेज इज टिल डेप्थ ऑफ एवरीथिंग. और मोस्ट ऑफ द पीपल दे हैव गॉट सुपरफिशियल नॉलेज ऑफ द थिंग्स, के थोड़ा सा पढ़ा और वो नॉलेज हो गई. बट ये जिस तरीके के आप अभी एक्सपीरियंस बता रहे हो कि यू डिड स्टडी अंडर माइक्रोस्कोप योर सेल्फ, आई थिंक दिस इज द बेस, दैट इज वाई योर फंडामेंटल्स आर सो क्लियर.
Yeah.
सो हाउ डू यू मेंटेन पैशन, कि बस मुझे ये करना और करते ही रहना है.
See, basically, it became a mission in my life that I must remove this word Banj from the
हम्म,
dictionary. So that kept me going still today. The conditions for a woman has not changed. So whatever is the situation, whether she is able to pay or not, whatever is there, so I try
वो
to.
हाँ मुझे पता है, आपको कोई फर्क नहीं पड़ता.
Yeah. So we must continue doing, because uh, knowing this woman's life, because many stories are there. So I know what a woman goes through when she is not having a child. So uh, whether husband
देयर
is
आर
helping
वेरी
her or
फ्यू
not.
पीपल इन आईवीएफ सर जो बिना पैसा देखे हुए काम करते हैं.
Yeah.
वेरी फ्यू पीपल. एंड अभी नाउ एट प्रेजेंट, since you have left the army, So now is the things going same way the way you started? Your juniors are carrying it forward?
Yeah, yeah, I'm very lucky that way because I before I left army, so we had the opportunity to train the gynecologists over there, and
Ah.
from two centers which I left, now there are seven centers which are
Oh,
working in the armed forces, and I'm sure it thanks
seven
to some.
centers where, sir? One Pune, Delhi, and
See,
where?
one is in Pune, second is in Delhi, third is in Colaba, that Navy, fourth is in
Acha.
Bangalore, then Guwahati, Bhopal, Jalandhar.
So almost all
All the corners.
पूरा India के every zone cover हो गए.
Yeah, but
Okay.
I'm sure there'll be some more centers coming up in the command hospitals. Yeah.
So funds, it was easy to get the funds in army, or was it difficult at that time?
No, see, initially, what happened was there's a slight story I will tell you again.
Mm.
Dr. Punita Arora, madam was there, so we have to make statement of cases and all. The statement of cases, they said, okay, you get it signed by a civil professor, and in
Okay.
civil there was no IVF center, so
Mm.
I had to take the file to Maulana Azad, and so that's when
Acha.
madam was there. She says, I don't know anything about IVF, madam. I said, you don't have to know anything, you just sign, because then you will
Yeah.
know what is the IVF later on. So I requested her, so she signed my first trial. That was the first hurdle. And secondly, after passing through the administrative, channels, uh, where Dr. Prinitha Madam, was a great help because with her, surveys and experience and her public relations, so she could get the file through. The final bottleneck was the financial authority. So I went along with madam to the, and he looked at the file and he says, "What infertility? You can tell
Yeah.
the soldiers to adopt, and this
Yeah.
much of money we can buy tanks."
अच्छा.
So
Okay.
that was the first.
हाँ नहीं वो
So
obvious thinking है sir.
yeah,
हम्म.
so because that is a more requirement for the army because
हाँ.
इतने सारे orphans हैं, they can always adopt a
हाँ.
child. But I
हाँ.
knew the problems of the
हम्म.
soldiers. So anyway, that meeting was almost futile. But while coming out of the meeting, I just asked him, can I meet you again? He just looked up and down because
हाँ.
he deals with high officials. I was just a major that time.
Okay.
So he just looked up and down. I don't know what happened, what spiritual thing happened. He says, okay,
हम्म.
come on Wednesday. So
हम्म.
then on the way back, madam was furious that the civilian don't know the problems of the army people. So, uh, you can leave army and, do work outside because she knew about
Okay.
my passion. But
हम्म.
then once her, tempers had come down, I told her, madam, this has happened. And he has, okay, you go alone. I will not come along with you. This stupid fellow. Anyway, so I carried one letter along with me which was
Okay.
written about 5 years back by a
हाँ.
soldier sitting in the Siachen glacier
अच्छा.
because I had
हम्म.
treated him with the basic medicines. They were having infertility problem, and with the basic medicines only the wife had conceived. So, in emotions, sitting in the Siachen glacier, he wrote what difference it made to his life, and then how he has become more interested in the army life. Otherwise, he wanted to leave army and do this thing. And the finally he had written that Dr. Sharma, there'll be many people in your life who will be putting stones on your हिंदी में लिखा ना आपके रास्ते में बहुत पत्थर डालेंगे. But
अच्छा.
please keep on fighting for the soldier. This is my
Okay.
request. So I said, sir, I got nothing to say what I told you last time. I just want you to read this letter and please see this letter is not written yesterday or today. It is 5 years back letter. So you please read it and then whatever you decide is okay. So when he read the last line, कि मैंने मूर्ख आपके रास्ते में पत्थर डालेंगे, so he realized he is the मूर्ख. So he says, where is your file? So I was carrying the file. So there he signed the sanction. And after that, he said, would you like a
डिपार्टमेंट बना हुआ है.
the tea
Okay.
with me? I said, sure, it'll be my player. So then he asked me, tell me one thing. Ki, why like, you were so persistent because once no. I said, sir, I have not come for my own interest. I have come for the interest of soldier, which is the backbone of the army. And this letter, says what the soldier means when they are having infertility problem. So anyway, that rest is the history. So we got the sanction, we got the thing made,
Mm.
and IVF center, because there was only one center. So throughout the
Yeah.
country, the soldiers were coming. So we had a huge number of patients, 200, 300 patients per day OPD, 30,
Sure.
35 pickups every day.
अच्छा.
So there was
Oh
no
my God.
embryologist. I had to
हाँ.
start in the morning, 7 o'clock, and
तो
night.
आपको सुबह से रात हो जाती होगी है ना?
Radbi, and that time, if you had to do freezing, 3 hours of freezing, also slow freezing. So I
हाँ,
used
that
to,
time.
so I developed vitamin D deficiency and all those problems, but I continued because I never exposed myself to sun. I was in the center only, almost 20 hours a day.
नहीं, आप द वे सिंगल हैंडेडली यू कैरिड इट फॉरवर्ड ना, और कहाँ से कहाँ तक उसको एक बेस बनाया, वो तो बहुत ही मतलब
Because there's a
बड़ी बात.
in the government that time,
हाँ.
you could have the equipment, but you could not create a new post because they
हम्म.
were trying to reduce the number of employees.
ओके.
So they could not create a post of embryologist. So I had to do
हम्म.
the embryology work also myself,
हम्म.
besides the clinical ultrasound, everything myself.
So if you have to do embryology work also, then so it takes lot of time. आपने ही पिकअप करा, आपने ही पहले क्लिनिकली पेशेंट देखा, सिंगल हैंडेडली एंड डूइंग 35 केसेस पर डे, इट्स वेरी डिफिकल्ट. पता नहीं कैसे किया आपने.
Janun tha.
So
Janun tha.
तो you really pushed the all the boundaries, I would say, है ना? अच्छा, आपको कभी लगता है कि आई ज्वाइंड आर्मी एंड दे taught you so much of discipline, did it help you?
Yeah, because
Hmm.
the main ethos of the army
Hmm.
is basically the commitment, discipline, and also integrity. And that is very, very important in every field, more so in the case of infertility.
अच्छा, एथिकल चैलेंजेस भी आए सर कभी? वर देयर सम एथिकल इश्यूज के जैसे समटाइम्स द पेशेंट्स कम्स and they will say that nahi, I need a boy only, those kind of things which
No,
are
see,
not ethically practiced by us.
yeah. No, thing is, I would say because this is a normal, culture of
हाँ.
India where the
हम्म.
male child is a very, very important thing because Mukhagni has to be given by the sun only, and the
हाँ.
Tarni river, which is there on the way to your Swarg, you stand on the back of your son. So that psyche is there in every, I would say, Hindu for that matter. And but since it is not allowed, so we had to tell them, it is not possible. And then giving them examples of the the women, especially in our department itself. The lady can become a journal, so why can't your daughter also become a journal one day? So whether it is a male or female, it doesn't matter how you bring up the child. So there was a lot of counseling required for those patients.
हम्म. So, whenever you were doing all this, so was there any difference in the treatment of officers and soldiers?
No,
Like
no.
higher officials, where they will not go to you, they will go to somewhere else.
No, no, I
Was
was
it
the
like
only
that?
one. I was the only one.
Okay.
So they
Hmm.
had to come to me only. Even
Hmm.
the from the first family of the country, president house also, then we had to treat so somebody from there also. And
Okay.
the patient, a patient is a patient. So whether it is officer or soldier, there's no discrimination about what drugs you are going to use and how you are going to treat them. Because as a doctor, I don't think that should matter at all. In one of the VIP patient, she had a genetic tuberculosis as per my assessment. So I
Okay.
told the head of the department,
Hmm.
because he used to accompany her. I said, she has got a tuberculosis. He said, no, no, she can't have it such from a VIP family, from the Singan Fogsi. I said, no, the tuberculosis doesn't discriminate. So,
Ah, of course.
so he
Hmm.
said, then you only tell her because I
Hmm.
don't want to tell her. I said, okay, you bring her. I to explain her, and she understood. And she took ATT and she conceived with, I think, first or second IUI only after that.
So, do you feel that army centers or army infertility centers they need some basic policy changes now, or are they going okay and they will go like this only?
No, the thing is, a few things need to be added. Surrogacy is not allowed in the armed forces.
Acha,
So
okay.
that should
So
be.
means that they have got different ART rules
No,
like
no, no. There's
which
no
we.
anti-rules. This is a, you can say
हाँ,
internal rule, you can say.
अच्छा that is
Yes.
internal rule के
Internal
सरोगेसी
rule
नहीं
because the
करनी है.
surrogacy,
Okay.
because surrogacy, there's so much of documentation is required, and then so many
Hmm.
years of documentation. The doctors keep on changing, the staff keeps on changing. So that is
That's
why
also an
possibly, but I
issue.
don't think
Okay.
nowadays, because many patients require surrogacy,
हाँ.
so unnecessarily they have to go outside, and outside how costly it is. So,
Hmm.
and it is very difficult for a soldier. And the second thing is the adoption also is difficult for a soldier. So
Why?
now these things should be, little more, regularized, and also, should be little less difficult for a soldier, because many of them want to adopt, but they can't adopt because they're not
Hmm.
staying at one place. And secondly, as per the
Hmm.
rule, there is a home visit by the counselor and all. Now the soldier doesn't want, they should go to the village and find out, because then it'll become talk of the village. And
Hmm.
village people, will not accept this child if it is a adopted child also, especially
Yes.
because land and other things are required.
हाँ.
So I think some changes in the government policy and the army policy is required as far as adoption and service is concerned for the soldiers.
So I think over the years you have seen a tremendous change in IVF
Oh
or
yes,
this treatment of infertility, है ना?
yeah, yeah. See, when we started,
हाँ.
only gonadotropin available was HMG.
हाँ.
Then came, highly purified HNG. Then came recombinant. So that is one change which we saw in these many 30 plus years. And the second thing was the culture medias. We were making our own culture medias earlier, and then came
अच्छा.
Me Too media, which is a single step media. Then the
हम्म.
special media came. Then again back we are coming to the single step media, and then the freezing changed from
ड्रग्स में भी tremendous difference आ
tremendous
गया है ना?
difference in
हम्म.
timing. Then micro tools. We were making our
हम्म.
own easy, needles and holding needles. We had a micro forge. We had a micro grinder. It was wonderful, working with those and making your own needles, ICSI needles and all. So that was a great fun making that, but it used to take time. And then the protocols, especially the antagonist protocol, which has come now. Earlier we were doing only agonist protocol. So OHSS and all was there.
कभी कोई जैसे OHSS की इमरजेंसी वगैरह होती थी तो फिर then you have to go to army hospital only.
Yeah, yeah, because the
Okay.
patients would come to the army hospital only because they are dependent on the army hospitals, and
So they are not charged.
no, 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 no. The IVF is totally free for the soldiers, and all
Okay.
the medical treatment is free for the soldiers because they are serving the nation.
Okay.
And so the OHSS was there that time. I wouldn't say it wasn't there, and
Hmm.
they were see another good thing which happened that time. The soldiers were given attachment to Delhi for their treatment for 1 year.
Okay. So they were sent to Delhi where RR hospital
They were,
was there and
yeah,
IVF center was there for 1 year.
for 1 year,
Okay.
so that they could come.
That
So
was
now,
that was good thing.
yeah,
Huh.
so then there were too much of overcrowding in Delhi, so they opened one center more like that, so that
Hmm.
equal distribution of the otherwise all infertile couples, so 10 to
Will
15.
come to Delhi only.
uh,
Huh.
so you can't give them place to live and all those things. So that
Hmm.
is another reason more centers are open there.
So, which is the most, I think, exciting technological advancement you feel is there in IVF since you started working until now? What is the most exciting thing? Is it embryoscope? Was it ICSI?
No, no, no. I think the most exciting thing is yet to come, because these were
Acha.
all, yeah. So that is, I think,
Okay.
artificial uterus. If it comes, that will be the most exciting thing to, because it will
So then
liberate
we
the
can
woman.
bypass surrogacy, huh?
No, it will liberate the woman.
Huh?
Because, yeah,
That way. Mm.
yeah, it will liberate the woman.
Yes, of course. Then all pregnancy related complications, huh?
Yeah, it will learn so many things,
Hmm.
She'll not have to go through the psychological, social, and other pressures on her.
So you have worked in military setup and then you have worked in that Primus hospital. So was there some difference in culture or you worked in that way only? Work
See,
culture was different here
I
in
mean, luckily
private setup.
luckily for me, there was no difference at all because
Okay.
I was
मुझे लगता है आपके स्टेचर को देख के आपको कोई कुछ नहीं कहता
yeah,
होगा, जो सर ने
yeah,
करना है उनको करने दो है।
whatever it is, yeah, because I was never pressurized to do, things which are
हाँ,
not right or this thing, and
हाँ,
so we did our best for the
हाँ,
patient and for the hospital both. Yeah,
हाँ.
yeah.
And sir, what about mental health? Do you think it is important to address that issue in infertile couples?
Yeah, it's very important part because there's so much of psychological effect is there, and it is not only for the patient, it is for the doctors as well. They also need to be mentally strong because otherwise, if you start, making it very personal failures, take it as a personal failures, that you can go into depression yourself. So I
हाँ, पर
think,
सर बुरा तो लगता है ना जब
no,
कोई
I
आप
agree with
करते
you.
हो फिर वो
Yeah,
फेलियर
yeah,
आ
yeah.
जाता है तो दो दिन
There's
तक
no
बुरा तो
doubt about
लगता है।
it. नहीं, ऐसा नहीं है कि मैंने की. It's not like
हाँ,
that. But you
हाँ,
learn from each failure.
हाँ,
Don't take failure as a failure. You take failure as a learning experience.
चैलेंज, हाँ,
What best I can do for the patient the next time.
हाँ. So, what misconceptions you think are there in this infertility? What misconception is which are very strong, which you think should not be there?
See, firstly, people should know that IVF is nothing unnatural.
Hmm.
It is, we are just assisting the nature.
Hmm.
Rest all the nature will take place, the duties of the nature will take place, what implantation, the
Implantation,
substitute
वो
for the
तो सब
baby and all,
नेचर पर
everything
ही
is
है, हाँ.
natural.
Of course.
We're just assisting the nature, but we are not taking over the nature. So there's nothing unnatural about IVF. That is one thing. And the
Hmm.
second thing is that are these babies going to be abnormal? No, unless
No.
there is a genetic issue in the family. Otherwise, IVF per se doesn't cause any abnormality in the babies.
Yes, that I agree.
And the thirdly is, with these movies coming, that mix up of gametes will take place. So
Ah,
that also, we have to be diligently working ourselves, and we should be seen diligently working also by the patients. So that whenever you are doing a process, you show them, okay, this is a semen sample, see the name written there, this embryo name written is there, so that they should not carry away with the message that what the movies have shown, that the mix-up can take place and all.
so what message do you like to give to young IVF specialists, those who are budding, just learning, जिनको अभी यही लगता है कि आईवीएफ में जितना पैसा है उतना दुनिया में कहीं नहीं है और जब आते हैं तो पता चलता है कि कुछ नहीं है इसमें.
And see, firstly, what I feel is I had recommended that time, when I was in the army that time, because there was no IVF center in the government setup. So ICMR and all these people, they had asked me to, set some ideas, they took ideas from me, how it should be. First thing I mentioned was that, after post graduation, every gynecologist should work in obs and gynae for at least 5 years, so that they understand the woman and they
Yes.
understand that the pathologies and all. They should otherwise, you're doing MBBS, MD, and then 1 year, 2 years of course, and then becoming an IVF
So
specialist.
I also feel the same, sir. हाँ, बेस ही नहीं बन सकता आपका जब तक
Base should be
आपने
strong.
नहीं.
Yeah,
हाँ.
that is one thing. And secondly, those who want to venture into the IVF, it is a good subject, and but then they should be strong enough to take the success and failures in an equal stride, and they should always be trying to learn more and more and keep themselves abreast. So it is a lifelong
Long
commitment.
learning.
It's not that you do one course and after that you become consultant directly, and uh, that you know all, because the things are changing so fast, so you have to keep abreast all the time.
So one most memorable story which you remember about your this IVF treatment or infertility couple treatment, कोई story जो बहुत आपको touch करी हो?
Yeah, actually, there are many stories, but the one which I remember, there was a young girl, she was a case of hypogonadism.
अच्छा,
So
ओके।
the parents had got her married, this thing, and she hid it from her husband that she doesn't get the menses. So she would pretend every month that she's having menses, stay away from the husband and
अच्छा,
all. What
ओके,
that is.
ओके।
But when the baby was not coming, so naturally the in-laws and all got this thing after you, why you're not becoming pregnant. So she
हुँ,
came to me. And when I
हुँ,
investigated and I found that she's a hypogonadism, so
हुँ,
so that means she has got a chance to become pregnant.
ऑफ कोर्स।
So firstly, the husband was also, initially very supporting to her, and both of them used to come together and all. So I had to prepare. Her uterus was small, so I had to give her withdrawal bleeding so that the uterus would develop, and then I would start the stimulation.
हुँ,
So I did finally IVF for her, and she won good number of eggs, and we did IVF. Unfortunately, it did not work that time,
अच्छा, ओके। फर्स्ट
and
साइकिल फेलियर हो गया
first cycle
मतलब।
failure.
हुँ,
So after some days, she came alone. So
हुँ,
generally, I keep on uh, as a doctor, that something is amiss. So I said, where is
हुँ,
the husband today? She said, sir, वो नहीं आया मेरे साथ आज. मैं क्या हो गया?
हुँ,
तो वो she started crying.
हुँ,
Sir, you don't know what I'm going through. I said, why? What happened? She, I called the nurse. I said, because I have to have somebody around, when such emotional situation is
हाँ, ऑफ
there.
कोर्स, हाँ, हुँ,
So I said, okay, sister, you close the door and let us listen to her. What she's problem. So she just lifted her shirt and showed me, belt marks on her body, because the husband was actually driver to some senior officer. The senior
हुँ,
officer would, shout at him every day, you are going this thing and leaving your job. So he could not take the, this thing from the senior, and at the
हाँ,
same
वो
time,
उसने आगे।
so
हुँ,
दोनों के बीच में फंस गया, एक तरफ वाइफ और एक तरफ सीनियर. So the
हुँ,
easiest prey was the wife.
हाँ, ऑफ कोर्स।
See, he had bashed her with the military belt, which is almost 4 inches. So there were 4 inches marks on that. So I almost, like your own daughter, you feel it. I felt so bad. But then I said, okay, don't worry. I will see what I can do for you. So then I called her, informed the unit. I said, I want to talk with the boy. He should come. So he came. I closed the door, and I listened to him. And I did not shout at him. I tried to find out. Then I realized that yes, poor chap himself is suffering from both the sides. So I
हुँ,
just put a little sense into his mind. He see this is not a right thing, but at the same time not scolding him, because I knew that will further
हाँ,
perpetuate the
फर्दर
problem.
एग्रावेट द थिंग्स,
Yeah,
हाँ।
aggravate, because she has complained to
हुँ,
the doctor and it has gone to
हुँ,
outside my family home. So I,
हुँ,
lovingly, like my child, I explained him and made him sing. And luckily, then she became pregnant. And that time, because first time it had failed, so I had
हुँ,
put three embryos,
अच्छा,
and all the three, got implanted. So that is
ओके।
another problem. So, but she was very
अनदर
happy.
प्रॉब्लम।
She was very happy, but I was not happy. I said, no, you can't have more than twins.
वी आर नेवर हैप्पी विद
So,
ट्रिपलेट।
so I said, okay, I have to reduce one. So she
हाँ,
said, sir, at no cost. He
हुँ,
says, क्यों? कहती सर आपको नहीं मालूम कि आपने मुझे मेहतारी से जो है ना रानी बना दिया है.
अच्छा,
मैं कहा व्हाट डज दैट मीन? शी
हुँ,
सेड पहले तो मेरे को जो है ना लाइक अ स्वीपरेस आई वाज ट्रीटेड. अब
हाँ,
तो मैं पानी का गिलास भी नहीं पीती, मेरे को उठा के लोग पानी का गिलास पिलाते हैं. My respect in the family has increased so much. I don't want to miss this chance now. I said, no, don't worry. I'll do my best. And I convinced the husband also. I did the embryo reduction. And finally, she had twins. And, that, touched with a young girl, she must have been just in 20s. So that reminds me how a woman suffers.
ऐसी कई सारी स्टोरीज़ होंगी, है
Yeah,
ना?
thousands of stories, thousands of stories.
हुँ, सो चलो कुछ रैपिड फायर करते हैं सर, वन लाइनर। अच्छा, हाउ विल यू डिस्क्राइब यू एज़ अ लीडर, योरसेल्फ एज़ अ लीडर?
Lead from the front.
ओके, सो आईवीएफ आपको क्या मानते थे आप पहले और अब क्या मानते हो? इज़ इट अ मिरेकल और इज़ इट जस्ट साइंस?
Both.
बोथ।
Because
मुझे
where the
तो
science,
मिरेकल ही लगता है सर कभी कभी
no, no,
जब
where the
साइंस
science
फेल
fails,
होती है
when the science fails, a miracle happens.
है
Because
ना?
many times, IVF failed and the patient conceives spontaneously.
हाँ हाँ।
Because
I
I
also
always
had
tell the
one.
patients,
I also had one patient hypo, and we did everything, and she didn't conceive. Then she went home, and after 6 months, phone आता है कि urine test positive आ रहा है, and we were like, "हैं, urine test positive आ रहा है?" So, army uniform आपको क्या लगता है? What do you feel? Is it a great responsibility or is it power?
no, it is the power to fulfill your responsibilities.
Okay.
Because
Any.
whatever,
Hmm.
Dr. General Punita Arora could do it because of her
Hmm.
seniority. Because I was just a
Hmm.
major. I wouldn't have been able to do it. But she
हाँ,
took it as a responsibility to bring besides other super specialties, IVF also, meeting the
hmm.
senior people, meeting this thing, and, getting the files moved. So it is a power with responsibility.
Okay. So your stress buster is what?
My normally listening to the bhajans and all. That is a meditation or bhajans.
Okay, okay. So आप regular meditation, you do meditation regularly or
Yes, madam. Yeah. I
daily?
learned, pranayam and
हाँ,
meditation when I was posted in Pune when the first center was to be started because I
okay.
knew the things are going to be difficult. So
Hmm.
people asked me, why you want to learn pranayam? I said, so that I can, help the infertile couples. So the teacher over there
हाँ,
was, quite
मतलब
happy.
अपना भी stress कम हो. So any book which has shaped you or कि जो आपको कभी बहुत पसंद आई हो, not our gynae books, I mean,
I
any
think
other book?
it's a Gita, which
Gita.
gives you, yeah,
Okay.
Srimad Bhagavad Gita.
So many people take lessons of Gita these days. वो कुछ YouTube पे and all this has become fashion सा ही है. मतलब
Mm.
I don't know कि वो मतलब if you read it तो you can't understand the depth of Gita, that means.
No, the thing is that Gita. See, I got Gita as a gift from my spiritual guru when
हम्म.
I was in ninth class, and I
अच्छा,
have been reading
तब से
since then.
रहेगा.
And
Okay.
I find that at every age, it has got a different
हम्म.
meaning. I must have read
हम्म.
it many times, but today, if I read it, I get a little more bigger, understanding than what I got when I was in ninth class or tenth class. So there are a lot of hidden meanings in that, and as you grow, so you will keep on grasping more and more of what is written there.
तो आपको टी, कॉफी, जूस क्या आप
Tea,
पीते
that
रहते हो? दिन में कितने कप पी जाते हो?
no, moderation only 1 or 2 cups of tea.
बस वन और टू. So, what makes army, a very special thing for you? Has it, maybe it has given you everything? Maybe that
Yes.
is, and
No,
anything else?
see, firstly, it gave an opportunity to serve the soldiers who serve the
Country.
nation.
Hmm.
That is the biggest, I think, opportunity which the army gave me. See, this, if you stay with the soldiers, which I have stayed for 5 years in the tents, I know if there is anyone who should be given the best is a soldier. He's a young boy, 20 year, ready to die for the cause, for his community, for his unit, for the country. I don't think anybody would do it because I've got n number of stories to tell you the commitment of
Hmm.
a soldier. So if I could or anybody can serve the soldier, to make his life a little easier, I think his life is fulfilled.
नहीं, आप सही कहते हो कि the people who are staying, young people who are staying at places like Siachen, दुनिया से बिल्कुल अलग. I don't know how they carry
We
on.
are celebrating Diwali, Holi over there.
Hmm.
Then there, see that first letter which I told you, that fellow was sitting in the section. In the depth
Hmm.
of his emotion, he had written, and that letter is worth reading. I have framed it and kept it with me
Yeah.
for the generations to come and see. What is
Hmm.
the situation? of a soldier that time,
Mhm.
and how they were affected by infertility.
Any quote which you remember or which you admire, which you like?
या खुद ही को कर
Mhm.
बुलंद इतना कि हर तहरीर से पहले खुदा खुद बंदे से पूछे बता तेरी
जी,
रजा
बता तेरी सीरियसली।
क्या।
अच्छा, इतनी सारी होम रेमेडीज, हाउ डिड यू लर्न सो मेनी होम रेमेडीज? आई एम रियली अमेज्ड जब आप हमें बताते थे इन आवर सेमिनार्स विच वी हैड मंथली ऑफ दिस डीजीएफ, सो एवरी टाइम यू हैड वन न्यू थिंग,
या
सो ये हाउ डिड you learn all these things?
Yeah, as I told you in my initial stages, when I
हाँ,
was there was nothing, and I was sitting in a field area. I knew
हाँ,
my job is to treat the infertile couple in future. I read
हाँ,
so many books, so many Ayurveda books. I read the homeopathic books, and I then tried to learn from the people, from my mother. The old women's remedies for the women problems, because the curd thing I told many times. You
हाँ,
know,
हाँ,
my mother used to carry one spoon of curd. I used to
हम्म,
wonder she can't put it on the whole body, as a
हम्म,
if she's using it as a moisturizer or whatever it is, why she's carrying one spoon
हम्म,
of curd. So then I asked one day, why carry curd? Then only dasna mein. I will not tell you. I said, no, you have to tell me. So then she told me that she just, puts curd on the hand and dab it on the private parts, wash her hand and take bath. And she never had any vaginal infection in her
हम्म.
life because
And
that
now we take it in capsules, huh?
now we are taking capsule, it goes through the gut, then it comes out through the
हाँ,
stool.
seriously,
So why
it
you have a
comes
long
through
route?
the anal
Why you
region,
have a
then
long
in
route
the
when any
perineal,
shorter
then
route is
in the
available?
vaginal.
The shorter route.
Right. So, in all your career, was there any moment when you thought कि I should give it,
No, no,
छोड़ूं आर्मी और चलूं प्राइवेट में ही कुछ करूं?
no, never, never. In
कभी
fact,
नहीं?
before leaving army,
हाँ,
I took voluntary retirement because after brigadier's rank, you have to go to administration. And since my
अच्छा,
passion
अच्छा,
was, I didn't want to go to administration. So
हाँ,
otherwise, I would have become a journal as well. But I
अच्छा.
thought, this is a bigger call. So I had requested, and took me 8 years to get out of the army. It was not easy to get out of the army because, I was required there.
Because आप तो बहुत काम वहां पे कर रहे थे, हाँ, they
I was
will
required
not
there.
leave you.
And in fact, I had discussions with
हम्म,
the seniors.
हाँ,
Even after, I would love to work in IVF throughout my life. You give me rank or don't give me rank, doesn't matter.
हम्म,
And after retirement, also you give me a smaller hospital and allow me to do IVF for the soldiers till my sunset years.
हम्म.
So they said idea is very good, but we can't change the rule. I said okay,
Army rules are very stringent, they can't change it.
so
So when
I
the
now I'm
first,
doing it outside. The same
hmm,
thing which was my dream that I must serve the soldiers till my
hmm,
last breath. I'm doing it today also the same thing. So most of the patients which you see in my OPD, they
uh,
are the soldiers or their families only most of the time.
okay. So, first child when you had from IVF, so how did you feel and how did you celebrate?
No, I didn't celebrate as much. See what happened. I would not call it a IVF baby. I'll tell you, way back in 90,
Hmm,
when I was just trying to do whatever was available that time before my study leave and before the IVF. I had my classmate, who was having infertility. And he had shown to all the then hi-fi IVF specialists, and they finally they had given up. So I told him, I said, you are my friend. I'm not charging you any money. I will
hmm,
just do the timed this thing follicle monitoring, and you do naturally. So
hmm,
he says, okay. With great reluctance, they had given up. So I said, no, no, you come and we'll do it.
hmm,
So I used to give them clomiphene, and she's a PCO case. That time clomiphene only was available, and then I would monitor by ultrasound. By the time I'd mastered the ultrasound also, and
hmm.
then at the time this thing we didn't have an IUI this thing, so I used to do the actors cervical insemination.
Sure,
So he
sure.
would give the semen sample, I put it in the syringe, and drop by drop I put it at the outside the
Yes.
cervix,
Hmm,
and it taking 5-10 minutes. The first cycle failed, second cycle failed, third, fourth, fifth, six cycles she conceived with this simple treatment. And
Uh,
so finally, the cesarean was to be done for her because she was a civilian. So I was posted in Trent, so he said, "You have to come there." Though doctor, I said,
okay.
"No, I can't do cesarean for you." This is, but he said, "No, doesn't matter. We want you to be there." So
Yeah.
I went there at the time of cesarean. The gynecologist were there, did the cesarean, and they were blessed with the son, the Christian couple. The
Mm,
mother-in-law came suddenly. She just took my hand, kissed it. She says, "Son, you got a blessed hand."
mm.
And that is the sort of current came into my whole body. Okay, maybe the mother has given a blessing to me. The possibility
Yes.
this would work out in life.
So कोई और भी ड्रीम है जिसे आप चेज कर रहे हो अभी? Is there any dream?
See, I have a dream. I don't know whether I'll be
Mm,
able to fulfill, but I'll try my best to have a
mm.
farmhouse IVF center.
Means?
So the couple should come there, stay there
हाँ.
for 1 month or 2 months in the
Okay.
natural environment, stress free from all these things, and
Mm,
do meditation, do this thing, and then you know give them a feel of the nature,
mm,
so that when they go out, so they would have a more meaningful married life, and they would have a more happy married life, because they would have gone through not only infertility treatment but other life changing experiences during those 1 or 2 months. So that is, I feel, if I can manage to do it, and if the patients are ready for it, because I feel,
patient also has to be ready
yeah,
to
because
leave the work for
it
two,
is a
three
patient
months.
who wanted, because the husband is working, wife is working, and the smog of Delhi and pollution of Delhi, little away from all these places, and little spiritual environment, little scientific environment, and a natural environment, all put together, amalgamation of all that, so that it should become a lifelong experience for them.
So your unseen pillar of strength is what?
But
Patient's blessings or your mother's blessings or
I
God's
think it
blessings?
is
क्या
all of
लगता
them.
है?
It is all of them. My
All of
mother's,
them.
my wife, my children, they supported me, because I sometimes joke with my children. I said, I always saw you growing horizontally, never saw you growing vertically, because I used to go, they were lying
सोए
on the
हुए
bed.
मिलते होंगे हैं?
And I would know, okay, now they are 2 feet, 3 feet, 4 feet, 5 feet, 6 feet. That is how. So I have a little guilt over there. Yeah.
बट वही है ना, सर पे सब कुछ नहीं हो पाता. So any failure which taught you some big lesson?
Yeah. The thing is, uh, that we should not become um, too idealistic and too this thing during a treatment. We should keep the patient informed, because sometimes we say, okay, no, let's not tell the patient, otherwise she will feel hurt
Mm,
about this thing, the result, and all those things. So when I came out from the army, there was a one very young couple, and she had a low ovarian reserve. So we said, okay, we will try for you. And the husband gave the sample, and unfortunately, though we had done the cultures and all, maybe he used saliva or something for collection, so the plate got contaminated. So I, told them the truth, because army, we don't hide anything. I said, "Okay, look, this is what has happened, and there is an infection, this thing. So no embryo is there to transfer." So suddenly that child, couple whom they were treating me like a father, they started treating me like a devil. So after that, I realized that every step we must tell the patient what happening, rather than just to keep them
हाँ,
their
मतलब
emotions.
we should not take it lightly. उसी टाइम में जो भी हो रहा है, that should be
तुरंत
told.
बता
हाँ?
देना चाहिए उसको, and
हम्म.
so that the patient should be well aware what is happening. so that they should not, like somebody pointing at your capability or something like that. So it hurts because you did your best. So that is the thing I learned the lesson that yes, at every stage, if the eggs are less, we should tell them the okay, these are the chances of your success, this is the chances of failure, and the male part also we should tell them exactly what is there. Not that ki, okay, they may, because as such, they were not having very cordial relations with each other, husband wife. So with
Sometimes.
that in mind, we says okay, if the baby happens, the things will change. So, but then that changed my, mood that day. I felt so bad. That is the worst thing a doctor can feel. The patient has
Yes.
some that type of
So
feeling.
one message. So now we are at the fag end of our podcast. So one message for our viewers.
Yeah.
For I would say for the couples who are infertile and they are trying to conceive, what would you like to tell them?
See, for the couples, I would say that you must know the doctor is trying the best for you, and follow the instructions diligently, because he should not think, okay, if he has told not to smoke, drink, doctor ko kya pata chalega, that sort of thing.
Ah,
Because after all, it is a combined effort. So we can't, take out a rabbit from our hat and give it to them. So they must understand the whole process, and they should have a equal knowledge of each step, and what are the success rates, what is the failure rates, and then they should do some research by themselves as well, and whatever queries they have, they must get it cleared by the doctors before they venture into the IVF, so that later on they should not repent that that we did not.
मतलब they should not be false hopes. Sometimes patients think के बस IVF हो गया तो बस होनी ही है pregnancy फिर क्यों? हाँ, this is
The only
you
thing
are
is,
right.
as a doctor, we can create bodies. We can't put soul into that. And every soul has got its own timeline, when it has to come, when it has to go. But at the same time, Gita says, "Karm karo, phal ki taraf na dekho." So similarly, patient should also that yes, you must select a right place, right doctor, right everything. That is your choice. And once you have chosen doctor, have faith on that doctor, and instead of going one place to another, because in first IVF, by chance if it fails, you learn so many things, so you can
Yes.
improve on
Yes.
that for the second IVF, whether it is a
Mm.
frozen embryo transfer or a fresh IVF. So if you're sticking with one doctor, you would get the better result, rather than changing at various places and having
And
moving from
mm.
one place to another place.
And you are very right. Whenever there is right time, only then the every block will fit.
Yeah.
You know?
Yeah, our job is to do the work, and
Mm.
their job is also, as the doctors and the patients, we should work together, with passion, with happiness, and with confidence, with faith on each other, and then we should leave it to the God also, because the we can't put soul into anybody. Neither we can stop any soul coming out of the body. That is the truth of life.
So that was so wonderful, sir, to talk to you. मुझे तो बहुत मजा आया और मुझे लगता है कि मेरे listeners को भी बहुत ही मजा आएगा ये सब सुन के and this will be on the YouTube for any time anybody can listen to this. So we take off for today and welcome dear viewers for the 298th episode tomorrow at 8 p.m. Thank you so much, sir. Shukriya ji.
Thank you, madam, and Jai Hind to
Thank
everyone.
you. Ah, yes, Jai Hind. Right word.
Jai Hind.
Thank you, sir. Thank you, ji. Okay. Okay. Namaskar.